This is Mont Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mont Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mont Health, you can feel the difference. Once again, welcome to this edition of Mont Health Talk.
And good morning. Welcome into the show. It's Mont Health Talk. I'm Dave Wilson. She's Sarah Giosi. Good morning, Sarah.
Good morning, Dave.
And why don't you do the honors this morning and introduce the guest to your immediate left?
All right. We have with us today Jacqueline Gay. And Jacqueline, you are with the Mont Health Wound Care. And we've gotten to have a little bit of a conversation, oh gosh, Dave, a couple months ago.
Dr. V.
With Dr. V. And we're very excited to now continue that conversation with you. Good morning.
Good morning. Yes. Shout out to Dr. V. Love her.
She's wonderful. She was so sweet. We were just talking about her off air. She was such a sweetheart. So why don't we start things out? This is how we always like to start the show. We want to let people have a moment to just get to know you a little bit. So start us off. Where are you from? Where did you get your education? Let's start there.
Okay, great. I am from Pittsburgh, Pennsylvania. I got my education, my graduate degree in physical therapy at Slippery Rock University. And I worked there for many years at Grove City Medical Center, and then I moved back to Pittsburgh, where I was at Allegheny General, the wound center there, a wonderful group of people. And then I met a man, a lovely man, who was from Morgantown, and he talked me into moving to Morgantown. So here I am. And I'm now at the Mont Wound and Vein Center within the Mont system.
It's funny how that happened. See, I'm from Morgantown, but I met my husband here. He was living here. I wasn't.
Is that right?
Next thing you know, here I am. I'm back home. It's
Dragged
funny
you
how
back
that
home.
happens. So why wound care? What brought you, especially with a background in physical therapy, where did that transition happen for you?
Okay, that's a great question. And a lot of people and patients will say, why, as a physical therapist, are you taking care of my wound? And if you look at the physical therapist's curriculum, huge component of it is gross anatomy and then pretty much every other science you can think of. So we have the skills to treat the whole person. So in wound care, if someone comes to me with say a diabetic foot wound, I am going to want to look at everything. The foot, how are we going to get the weight off the foot, offloading, assistive devices, and nutrition, diabetic education, so the holistic treatment. So being a physical therapist is kind of a perfect path to get into wound care. I got into it just starting right out of school, and it's been my focus for 16 years.
You know, I wouldn't have immediately made that connection, but as you're talking, it makes perfect sense, actually.
Yeah, it
does. Really does. So you could have theoretically done this anywhere. Why Mont Health?
Well, Mont Health, when I came to Morgantown, most of the wound centers here said we don't hire physical therapists. It just isn't in the, it just hasn't been something that they have done. And I heard very, very good things about the Mont Health Wound Center, Wound and Vein, and through the help of some wonderful people within the system, they were able to create a position for me and kind of open up to the idea that, hey, maybe a physical therapist would be a nice person to have on the team.
And sometimes it's nice to get someone on the team that has a diverse way of looking at things, because we can, when looking at the body holistically, start to get some of these other ideas.
Right, exactly.
And step outside of our own comfort zone sometimes in a way that can be really positive for the body.
Exactly.
Now, what do patients come to you to discuss? What do you see patients about? Help me understand kind of what's your day-to-day?
Yeah, absolutely. I could say that I'd say a large percentage of our patients are suffering or struggling with diabetes. So they'll come most commonly with wounds of the foot. A lot of people don't understand why that happens, but it's kind of the high sugar levels hit the nervous system kind of first, and the nervous system controls sensory and muscle motor. So not only do they lose some sensation in their feet, but their feet fall apart due to muscle weakness. And then the foot just isn't hitting the floor as a normal foot would, and they get wounds that are very difficult to treat without, like I said, going into a whole holistic program.
Yeah.
Arterial wounds, veins, bad veins are a big component of our patient population. That's something I could lecture on for,
I'm sure,
for many hours. And then we have the traumatic dog bite, cat scratch that kind of falls apart, but we see it all head to toe.
We're going to squeeze in a break in. When we return, we'll continue the conversation with Jacqueline Gay, Mont Health Wound Care. Some preventative measures folks can take and contributing factors to chronic wounds. We'll get into that as well. Plus, who's a candidate to use the hyperbaric oxygen chamber? It just sounds really cool, doesn't it?
You just wanted to say
I
that.
I did. We'll continue the discussion with Jacqueline Gay, Mont Health Wound Care, as Mont Health Talk continues on WAJR. Joining us in studio today for Mont Health Talk, Jacqueline Gay, Mont Health Wound Care. And it's always easier to prevent than treat, right? At least that's what everybody tells me when they come in here. What are some preventative steps? And then we'll get into some of the chronic wounds that you have to deal with. But let's start with preventative. What can you do to prevent having to come see you?
It's harder, I'm sure, than it sounds, but step away, stop all the sugar, high fructose corn syrup, fast food. McDonald's is a great company. I'm not saying anything negative about them. And how about exercise more, smoking? These are all factors that contribute to type 2 adult onset diabetes, as well as arterial disease, coronary artery. So if we can just live a healthier lifestyle, we're much less likely to develop.
It's always the answer, Dave.
Exercise, diet, and quit smoking.
Quit smoking.
Or
It's
don't
always
start
the
in the
answer.
first place.
Right.
Well, I want to go back to what you first said, where you said it's harder than it sounds, but at the end of the day, it's actually a very simple solution, but that doesn't mean it's easy.
Yeah.
There's a difference between simple and easy.
Well, most of our patients who, not all, but most of the patients who are type 2 got there because they weren't thinking about their health and they weren't paying attention to healthy living. So it's very hard for them to make those changes. If we just start with our children, and show them a healthy lifestyle, they're probably going to grow up enjoying a healthy lifestyle.
Yeah. Again, not easy, but simple.
Yes. Pretty simple.
So we've talked a little bit about how to prevent, and again, it goes back to those basics. But what happens if we're already there, and maybe we're ready to make a lifestyle change, but it's a little too late in regards to wound care? We've already got some wounds.
Right.
What do treatments look like? What are some of the options that individuals have out there?
Okay. First of all, one of the most critical things to a wound is that we keep it. We do what's called debridement, which is removing the biofilms, removing the dead tissue to really speed the healing along. And then we have 1,000 different treatments, including some what we might call artificial skin. We have lots of silver, medicated, impregnated dressings. We have a lot of different modalities that we can do. But ultimately, the most important thing is, for veins, for example, is clean the wound and do compression. Compression wraps, compression garments. And in general, the myth is keep your wound open to air. No, we want to keep it moist and covered, just like nature's Band-Aid would be. Yeah. So there's 1,000 things we can do, but ultimately it's up to the patient to kind of come to us and listen to us, trust us, and be compliant with the program. We'll get you healed up.
Dave, do you want to start asking questions about your oxygen chamber? I know you're really excited about this.
Well, explain what the hyperbaric oxygen chamber is.
Well, now, I'm not an expert in the hyperbarics, but we do have experts at the Mont Wound and Pain Center. Wonderful doctors and nurses who man that. But it's basically you're put into a chamber, and it takes you down like scuba diving into subatmospheric pressure and oxygen. I think it's 100% oxygen, if I'm not mistaken, and then that creates a higher oxygenation of your tissues to help healing.
Okay, so who might be a candidate for that? Who might be one of your patients you would refer for that?
Absolutely. So we see diabetic wounds that are failing to respond to treatment. I believe arterial wounds can be a candidate. It is an arduous process, 2 hours a day, every day, 5 days a week for many weeks. So it's not something that we take lightly, but they do use it to treat acute carbon monoxide poisoning. And people, scuba divers who come up too quickly and get the bends.
Oh, wow.
So it's pretty remarkable. It's a really good option.
Bet you that's a fancy piece of equipment to have over there at Mont Health.
There's 2 chambers, and they're very, very dramatic.
Yeah.
You know what's great, and we hit this, I think, just about every single week we talk about this, Sarah, when people think they need to go to get this kind of specialized treatment. Oh, I got to go to Pittsburgh. I got to go to Cleveland. I've got to go to Columbus.
Right. No.
No, it's all right here in your backyard.
Yes, and we are so happy to accept self-referrals, patients who are just struggling with something now, not just wounds. You can certainly come to us for with swelling of the legs, lymphedema. We have some amazing lymphedema therapists, which is a little-known disorder, but it affects a lot of people. So, yeah, we are happy to try to take care of our people.
And you mentioned self-referral, but for the most part, to come and see you, do folks need to get a referral from their PCP?
They do not, but they certainly can. You know, and the physician might be the person to say, hey, this is something I don't think I want to manage here. Let me send you.
You need to go see Jacqueline.
Yeah.
You got
We'll
it.
continue the conversation with Jacqueline Gay, Mont Health Wound Care. On the other side of this break, it's Mont Health Talk on WAJR. Jacqueline Gay, Mont Health Wound Care, joining us in studio. And if listeners are going to take one thing away from this show, what should they take away?
Well, I would say that no matter what problem you're having, wound-wise, vein-wise, don't be afraid. Come to us. We will be kind. We will be gentle. And we will do our best to help you heal so you don't have to suffer that anymore. So just don't be afraid and come in, and we'll talk to you about anything and everything to help you get better.
And don't be embarrassed or ashamed.
No,
That's one of the
heavens no.
things that I think I see a lot or hear a lot, and it comes into the world of being afraid. You think, okay, I've got to go in, and you kind of are thinking about this from it's a huge medical complex, and these are physicians, and everything. It can be very intimidating, but it's very compassionate, actually.
Yes, absolutely. And yeah, I myself, I don't like going to doctors.
Sure.
Makes me very nervous.
Yeah.
And I don't like it at all, but yeah, that's what we're here for. We care. People who, I've realized something in my career, is that people who work in wound care tend to be really kind, amazing people. Not that isn't true of all medical professions, but there's just something about wound care. It's not easy to do as a career. It's sometimes emotionally challenging, but the people that get into it tend to be very kind and do it for really good reasons.
Yeah.
So, yeah, don't be afraid.
Do you often get patients going, well, that wasn't as bad as I thought?
Oh, absolutely. Yeah. And wow, look at the difference.
Mm-hmm.
If I've been suffering this wound for a couple of years, look at the huge difference once we just put a few of the protocols into place to help them to heal.
Talking to Jacqueline Gay, Mont Health Wound Care. And just one more time, and we know when we're talking preventative steps, and this can go across the board. We can say this, we should just get it on a loop, Sarah, and we can play it every Monday.
Right.
Diet, exercise, and if you're smoking, stop, or just don't start to begin with. That's going to help so much And you're a very lovely person. I mean, I've enjoyed this visit, but quite frankly, I don't want to come see you.
I hear you.
That's all the doctors that come in here.
That's right. Yes. So, yep. Once again, if every little step we can take, especially smoking, and don't vape either. You know, we're seeing what.
Yeah, that needs to be
problematic
said
can
now, doesn't it?
Yeah. So just step away from that and find something fun to do other than smoking. And I know that eating can be a challenge because eating well can sometimes it's oftentimes expensive. And in our society, in our area, not everybody has the money to buy organic produce, but the options are out there. And if you talk to your doctor, they can offer you.
And it's more expensive to not be healthy.
Yes,
I say
in
this
the
all
long
the
run.
time. In the
Yes.
long run, yeah. It's
Yes.
not if you look at this long term, it's more expensive to not be healthy than to
Especially-
eat healthy.
Right. The most expensive thing is the cost of life or quality of life.
How can folks get more information if about the Wound Care Center or about you, for that matter,
Yeah.
if they want?
Well, certainly they can go online, and there's on the monhealth.com/wound care. There is a narrative there about the wound center. Feel free to call if you want to set up an appointment, or like we said, ask your doctor for a referral, and we would be happy to see anyone for any reason.
And of course, the
Facebook page.
Absolutely.
Ah,
Don't forget
the
about
Facebook
the Facebook
page, yes.
as well. What's the most rewarding part of your job?
Oh, it's so rewarding. That's why from day one, I got into it, is the happiness that our patients feel when they graduate, in quotes, from the wound center, helping people to heal. It's such a dramatic impact on the quality of their life. And to see them moving forward and no longer struggling with the consequences is just amazing.
You mentioned it can be emotionally taxing,
Yes.
but it sounds like the other part there you were talking about, that outweighs
Oh,
all the
absolutely.
other negative stuff.
Absolutely, yeah. And we develop sometimes lifelong friendships with our patients because we might see them for months if it's a serious problem. It's not like they just come to us once a year. So it's the friendships, the relationships, and it's very rewarding just to help people get better.
Yeah, we talk about that a lot too. Again, you've got it in your own backyard. These are, community members. It's not just a random patient from somewhere. This could be your neighbor down the street, somebody you know, and I think that
Absolutely.
helps the whole process along.
It does. As example, my very first patient, his wife was a friend of mine from WVU. I had worked over at the physical therapy program, and I was like, "Hey, small world."
Yeah.
So, yeah.
Jacqueline, enjoyed the visit today. Thank you for stopping by.
Thank you for having me.
Jacqueline Gay, Mont Health Wound Care, our guest today. You've been listening to Mont Health Talk on the Voice of Morgantown, WAJR.